You've done an incredible job, and I know you know Jill. I'm Jill's husband. Been out to Navajo Nation now on 3 occasions, and one of the things that a closing comment. I'm trespassing on your time, I know, but I'm of the view, and I've been characterized as a congenital optimist. So maybe you can discount what I'm about to say. But I think the experience we've had with what has been one of the, because of all of your work, maybe the most significant major logistical undertaking that we've ever done short of war here, getting all this out and done, or continuing it done. I think we're going to find the lessons you've all learned, and we've all learned from this, are going to apply to a whole hell of a lot more of what we do in terms of delivering health care. And I'm not talking about more government spend. I'm talking about be able to communicate and connect people with basic health care. And there's new science going on right now about the mRNA, capacity to be able to adjust to maybe even dealing with cancer and other diseases. And I think that I think that they're going to be other pandemics, and we've got to. And I'm dealing with other world leaders about how we're going to deal with it, because you can't build a wall high enough to keep a virus out. But I am optimistic. I think we're going to see in the next 3 or 4 years the ability to provide access to and uptake of significant additional healthcare initiatives that are going to affect everything from the basic scientific research the companies like Pfizer and others are going to be doing with their mRNA vaccines, as well as applying it to other diseases as well, and some of them communicable diseases. But at any rate, I just want to thank you all. You've been great partners in this effort, and I hope we haven't been an impediment. We've tried like hell. No, I really mean it. We've tried like hell to include and engage you all as much as we possibly could and not get in the way. I know occasionally, when I got some criticism when I decided we were going to engage the public health clinics around the country and get them involved, and not from you all, but from others. And but I think you've done an incredible work, and it's why I think we get a lot more done at the state level in terms of cooperation among Democrats and Republicans than we do federally. And so none of this could have worked without your leadership. I really mean it. I'm not trying to be solicitous. I'm being completely honest. So thank you, thank you, thank you. I think you're responsible. I know you're responsible for saving thousands of lives. The idea we've lost well over 550,000 lives, more than every war we've fought combined in 1 year, basically, is astounding. And imagine what it would be if we didn't have you all doing what you did. So thank you, thank you, thank you. And one other thing you're going to be hearing about, it wasn't supposed to be part of what I'm talking about, but every country in the world is now looking to us to provide for their lack of capacity to produce and or have vaccines. I'm not going to shortcut the United States of America. I promise you we're going to have enough vaccine for every single American. But we are going to be engaged in working with other countries, because there are going to be a lot of variants that are going to be coming from other countries that we're going to have to be aware of as well. But and I may get back to all of you for some ideas on how I go about doing that. But I think we can produce a whole hell of a lot more vaccines that we can make available. We've already, how many we got out?
We've committed to 60 million doses.
Well, we're not using the AstraZeneca vaccine, and I've committed the distribution of 60 million doses to 2 other countries, our neighboring countries, who are desperately in need of vaccines. But there's just an awful lot. I literally have virtually 40% of the world leaders calling and asking, can we help them? And we're going to try. But at any rate, I just want to thank you again for what you've done. You've been wonderful, and I look forward to seeing you all in person as soon as we get everybody, we get above that 70%. Thank you, thank you, thank you.
Thank you.
Appreciate it.
Thank you, Mr. President.
Thank you.